Well, thank you so very much. We did try putting a 10% increase in the budget, but
We appreciate the effort.
I know we gotta keep working on it.
All right.
So, Eddie, Mr. Winfield, I just had a question in terms of, well, actually for both of you. So, I understand. So the state basically takes the funds and distributes it amongst the regional centers. How do you decide how much you distribute, and what kind of, do you have sort of performance standards or other types of oversight after you distribute the funds that I'm sure they all do a great job, but I'm just in terms of what kind of measures are we using to look at outcomes related to the funding? Yeah.
Yeah, the funding is actually in two different buckets. So there's
Okay.
the operations funding for regional centers to hire their staff and to run the operation. And then there's purchase of service dollars used to fund the actual services they fund.
Okay.
We look at the historical trends of regional centers' funding of services. And the services, as we said before, are an entitlement. So the services that are being provided pursuant to the IFSP or IPP, those services will continue on. And so we look at those trends and look at what we're seeing in terms of new services coming online so that we can determine what the budget should be for each of the regional centers for purchase of service. With operations, it's also pretty complicated in terms of core staffing formulas. So we look at the numbers of individuals they're serving, the numbers of staff they have, and how many case managers they need. And there's a formula that's used to come up with their operations budget.
So just to actually, so based on, so you look at the trends that are happening, and so this is actually, because it is an entitlement though, is that are you basically saying that, okay, this is our pot of money for this year, and based on our trends, this is how we're distributing it? Or there isn't a thing where, okay, this is how many service we provide over the year, now we bill, or we make up or reconcile a difference? Could be that your trend is right. Some, trends can be difficult sometimes. So I wasn't sure how you go about doing that. Is it sort of like, we guess this is how much you'll be providing, so this is how much you get for the year? Or is there any sort of back reconciliation for differences that might have happened in the actual year? Yeah.
Well, it's a pretty complicated methodology for determining what we believe the budget will be for the upcoming year. And so we use the trends from the past and look at the future services. And there are times when funds have to be shifted from one regional center to another to account for maybe a lack of purchase of service funds or an increase. So we just monitor that throughout the year, and we need to live within our budget each year, so that's our goal.
Okay.
Yeah, so 90% of the budget goes to purchase of service. So the couple 100,000 vendors that the regional centers use throughout the state for a myriad of different services, and about 10% goes to the operations budget, which primarily the largest percentage of the money clearly is for case management services. And there was a time, not a long time ago, when there was more money in the system than it was used, and money was reverted back to the state. Those days are long, long gone. We haven't seen a year like that in many, many years. One of the other challenges that we have, of course, is that the types of folks that we're serving today is different than what we served 20 and 30 years ago in this system. And the needs for folks, particularly in the autism world, and I'm a parent of a child with autism, so I know a little bit about this subject area, is different than the needs for others in our system. Similar in some ways, but different. An expensive group of folks to support. Right. And we really need to take a look at reversing a number of the actions that were taken during the Great Recession, including the new program development freeze that's on. We're unable to develop new programs at a time when we're desperately in need to develop programs for children and for adults as we move forward in this process. The rates that we pay providers are abysmal, and the caseload ratio for regional center case managers no regional center is currently in compliance with the federal requirements that we hang our hat on to get the federal dollars, the much needed federal dollars into this system. We're at jeopardy of losing those federal dollars if we don't do something about that caseload ratio.
So that's that 42% that we're talking about from feds?
Right.
We're not meeting those.
Right, we're not meeting the requirements, and that's very unfortunate. What sets California apart from so many other states is we rely, all states rely heavily, and some states exclusively, on federal dollars. We have a large state contribution to our program, which makes it extra special for the folks that live here in California. But we have fallen so far behind in every level. We talked about California being 50th. Well, we're like that in almost every area now in our developmental disabilities services system.
Okay. And then I guess, so you made reference to there's federal requirements, or, well, they're not just standards, they're requirements for the program. Are there, in terms of state oversight, is there other standards that the state also looks at, that it reports on, or do we just use the federal one, and does that come out in the report in terms of, I mean, he just, it was just mentioned that we're not in compliance. Is that something, do you agree or not disagree with that statement, I guess?
We have a whole number of ways that we monitor and oversee regional centers. What he's referring to is the assurances that we've given to the federal government about the types of things that we will do to ensure that services are provided to individuals with developmental disabilities. And according to law, the regional centers are supposed to have a caseload ratio of 1 to 62 for individuals who are on the HCBS waiver. And it's true that of all of the 21 regional centers, none of them are currently meeting that requirement. But the department does have a whole number of ways that we monitor and oversee through fiscal audits, through program audits, and other items like that.
Okay. So probably the similar question I've asked the previous two panels. If we do work, and I don't know whether you're looking at measures, any measures specific to children with special needs, and clearly a lot of children with special needs who are in this, in this program. Is the agency willing to work with this committee and with others to try to, if we were developing a dashboard or report card for children with special needs, to help us provide data or also technical assistance in developing such measures, especially related to children who need developmental services?
Absolutely. Happy to help with
And you have the commitment from ARCA
Okay.
to do just that and more.
Wonderful. Okay, because I think that's, obviously it's very disturbing to hear, although that's not the first time I've heard it, that our caseloads are out of compliance, and certainly concerned about the outcomes that has on, more importantly, on the families that depend on these services. The other question, I guess, is in terms of the interface between, because you mentioned autism, and we do require health plans to provide some coverage. Medi-Cal is providing coverage for some ABA services. We have developmental centers, we have schools and special ed. How do all those come together from your perspective? I know that I have to admit that as a pediatrician, I often turn to developmental centers as being actually the most likely place to actually really get them. But admittedly, this was before the law that was passed, before the DHCS's decision to now cover through Medi-Cal plans. But how is that going? Or do we have a lot of overlap? Or how are we trying to coordinate between all those, or actually try to reduce duplication if theoretically at least we have services that may be covered by multiple sources?
Well, it was a sea shift in the way we fund ABA programs when SB 946, Senator Steinberg's bill, was enacted. And clearly the regional center clients make up a large number of folks that are currently receiving benefits through health plans and now through Medi-Cal in this area. The cost of those programs have been shifted essentially from the state over to the health plans and to Medi-Cal outside of the regional center system. We still provide behavioral health services in a number of other areas and ABA services to clients who don't fall in those two categories. We're concerned, of course, SB 946 is due to sunset in 2017. I'm sure there'll be legislation before you in the next year to take a look at extending or removing the sunset altogether. It's been an effective program, not only for regional center clients, but the beauty of SB 946 was that even if you're not a regional center client, you can access ABA services for a child on the autism spectrum. We have strict eligibility requirements in the regional centers to get in under the autism diagnosis, but we know that there are thousands of children out there and adults with autism spectrum disorder who are now eligible for services through their health plans and through Medi-Cal.
Excellent. Okay. Well, again, I want to thank you so much for your testimony. Obviously, we have a lot of challenges in the space, and there's very important services. Certainly, as a pediatrician, early start. I mean, the benefits from that, even financially, I think, are large, as well as many of the other services. And I appreciate both of you. Thank you so much for coming to testify.
Thank you.
Thank you.
Thank you, sir.
Okay, next panel is on education services. I think we've made a lot of references, but now, so we have Chris Druin, Associate Director, California Department of Education Special Education Division, Becky Bryant from Sac City Unified School District, Bob Hamilton, President of the California Association of Resource Specialists, and Sharon Sinclair, Health Consultant Supervisor, Tehama County Department of Education, and from the California School Nurses Organization. Thank you all for coming, and yeah, if we can clear the... And some people would say one of the major tasks of children, all children, including children with special needs, is to learn. So thank you so much for being here. And we'll start with Chris Druin.
Good morning, or good afternoon, I guess it is. My name's Chris Druin. I'm the Associate Director of the Special Education Division in the California Department of Education, and we'd like to thank you for inviting us here this afternoon.
Thank you.
I'd like to start with an overview of services. Children qualify for special education-related services if an individualized education program team determines that they have a disability, and because of that disability needs special education and related services. Generally, this means that their disability affects their ability to access and make progress in the general education curriculum. It's important to recognize that education is not necessarily a health treatment or a mental health treatment program, but rather a place to educate children, and that's the thrust of what we do. Just to give you a sense of the size of our program, in 2014-15, over 666,000 of California's 6.2 million children in kindergarten through 12th grade programs were identified as receiving special education. That's about 10.7% of all school-age population. This percentage has increased from 10.1 to 10.7 since 2010-11. Special education-related services are provided by a large number of agencies. There are 133 special education local plan areas, 1,700 local education agencies, 58 county offices of education, 2 state schools for the deaf, and 1 state school for the blind. In addition, local education agencies contract for services from non-public schools and agencies. These are private nonprofit agencies that provide services and that are certified by the California Department of Education. State and federal laws include a number of procedural and service requirements, and they include Child Find is the first one. LEAs are responsible, that's local educational agencies, I'm going to probably use that acronym a bit, are responsible for having procedures to ensure that all students with disabilities who are in need of special education-related services are identified, located, and evaluated. Students identified as potentially eligible for special education are entitled to an assessment to determine whether they have a disability that negatively impacts their academic progress, and the assessment is to help plan a program to address their needs. Based on the results of the assessment, students eligible for special education have an individualized education program developed for them by their IEP team. That's another one of those acronyms that I'm going to be using. The IEP team identifies the appropriate educational placement for the student, goals for the student to achieve during the term of the IEP, and the related services the student is to receive to support the student in making progress toward their goals. Each IEP is reviewed annually to ensure that current placement, goals, and services are working for the student, and if not, to make appropriate changes. Students, first and foremost, receive special instruction, and that special instruction occurs in a number of settings based on the principle of least restrictive environment. So first and foremost, students are served in regular classrooms, and they're only placed outside of regular classrooms if the nature or severity of their disability is such that they can't be served adequately in a regular classroom. They're also served in resource rooms, in special classes, in special centers, and non-public schools. In addition to special instruction, students receive needed related services. Related services include transportation and a variety of services that may be required to assist the student to benefit from their education. These include such things as language and speech therapy, occupational and physical therapy, a wide variety of individual, group, and parent counseling services, behavior intervention services, and health and nursing type services. So that kind of covers a bit of the services. Let's turn now to funding sources and how funds are distributed. California provides approximately $4.46 billion for special education-related services. 73% of these funds are from state sources, 27% are from federal sources. Over the last 5 years, as you might imagine, federal funds have decreased and state funds have increased. We know that very well. The general education funding is not included in that. But the thing that's very important to know is that students with disabilities are students first. And as a result, there is an expectation that a large portion of their program is paid for. Their general education is paid for out of general education fund sources. Special education funding is distributed through the special education local plan areas. And as you probably know, special education local plan areas are a single district or a group of districts who are of sufficient size and scope to be able to plan and provide all of the services that students with disabilities might need. They receive special ed funding on behalf of all their member LEAs in the case of a multi-district SELPA, and funds are distributed according to an allocation plan that's developed locally by all of the member LEAs in the SELPA. The CDE allocates budgeted funding for each LEA based on a formula either established by Congress in the case of federal funds or by the legislature, depending upon whether it's a federal or state fund source. CDE allocates, that's the California Department of Education, I'm really bad on acronyms, sorry, allocates about $3.25 billion in special education general funds. Those go into two main programs. About $2.7 billion of that is our general special education funding, or AB 602 as it's known, because after the legislation that established it. The other large chunk is the educationally related mental health services. That's about $361,000. Oh, I should say that you don't need to write all these numbers down because we have some testimony we'll be passing to you afterwards that have all these tables and charts. CDE also allocates $1.2 billion in federal IDEA funds through grant awards. And these grant awards are specified, the formulas are specified by the federal government and are based on a three-part formula. The first part of the formula is a base amount, and that was established in 1999. Any amount above the base amount that is allocated by the feds is allocated to districts based on 85% of the amount allocated on the base of the population. So a bigger district gets a bigger portion of that. Has nothing to do with the number of kids with disabilities. It's the overall population of the school. And 15% is based on the overall population of those students in poverty. Okay? So federal funds, you know, we have several different grants, but they're all basically from the same place and have the same funding formula. There's the one that goes for school-age programs, there's a preschool one, there's a preschool local entitlement one, but they're all based on the same kind of formula. Also out of federal funds come Family Empowerment Center funding that's specified in the Budget Act and in the law. There's also mental health funds that come out of the IDEA in the amount of about $69 million. There's instructional materials money and transportation funds for state special schools. Lastly, the needs of students with disabilities are complex, and students often need services that are provided across service sectors. That's kind of what today's all about. And they involve multiple agencies. School personnel, and I bet my colleagues here will talk a bit more about that, work with staff of other local agencies to coordinate educational, therapeutic, and medical services for their students. In recognition of the importance of coordination, both federal and state policymakers have sought to ensure this coordination at the state and local levels. In California, there are two legal sources that guide coordination of services among agencies. The first is derived from the IDEA, the Individuals with Disabilities Education Act, which requires the chief executive officer of the state to ensure that an interagency agreement or other mechanism for coordination of services is in place between the Department of Education and any other public agency that is obligated under state or federal law to provide special education-related services. The second is, and the CDE has relied on this, is the interagency provisions of Chapter 26.5 of the Government Code, or 3632 as it is commonly known, which was significantly altered by AB 114 in 2011. So we had a law, it kind of blew up a little bit, okay? We are, at CDE, actively coordinating with several other state agencies related to special education. The first is the Department of Developmental Services. We have a part in the Part C program, the Early Start program. So we provide services and work with the Department of Developmental Services, which is the lead agency, to provide services to all of the birth to 3 students in the state of California. Our part is primarily children who have solely a low incidence disability, children who are blind, deaf-blind, and have severe orthopedic impairments. We also are working with the Department of Developmental Services and the Department of Rehab on a memorandum of understanding to increase coordination and opportunities for competitive integrated employment for students with significant disabilities who are 16 years of age and older. This is something we're actively doing kind of right this second. We also contribute staff time to support the Department of Healthcare Services in their administration of the LEA Medi-Cal billing option. LEAs are not, it's not a mandatory program, but they are participants actively, and we generate, they claim, about $136 million in funds through that program. We are working to establish a new agreement with the Department of Healthcare Services regarding mental health services. That came up a little bit earlier. Under AB 114, under 3632, the specifics of the referral timeline, what needed to be in a referral, who did the assessment, what was the IEP, who was responsible for the IEP, who did what, was all laid out in law. That was all removed by AB 114 in 2011, and that has been problematic since that time. There's now considerable uncertainties locally about who's supposed to do what when and who's the first payer, second payer, what have you. Okay, lastly, CD is also seeking to update agreements with the Departments of Social Services, Department of State Hospitals, and DHCS, and with DHCS as it particularly relates to California Children's Services. So thank you.
Thank you. Thank you so very much. It's been very informative. Ms. Bryant from Sac City Unified, welcome.
Hi, thank you for inviting me here today. I represent Sacramento City Unified School District, the Special Education Local Plan Area, which is the long version of the word SELPA. I'm here today to share with you how special education services are provided to our eligible students from birth through age 22. Before I'd start, I'd just like to thank you for convening this committee. This is a great opportunity for different parties to get together and hear what everyone does and hopefully work together in the future. And also to thank you for presenting to the Senate the Assembly concurrent resolution in regards to People First language and its importance to all the citizens in California. So thank you for that. In California, our SELPAs are geographic catchment areas for funding and services. We have both single and multi-district SELPAs, depending on the size and scope, as Mr. Druin said. Sacramento City Unified is a single district SELPA, and we provide all of our special education services to our eligible students ages 3 to 22. We do have a contract with Sacramento County Office of Education to provide our services from birth to 3. Students become eligible for special education services through a very thorough multidisciplinary assessment process. Students must meet an eligibility criteria for one of the 13 eligibility criteria, categories. An individualized education program team or IEP team meeting is convened to discuss the results of the assessment, the eligibility, to develop goals and objectives, and to determine the scope and the complexity of the services a student will receive. Parents are an active participant in this IEP process throughout the time. Some examples of our services that may be provided are speech and language services, specialized academic instruction within a general education setting, specialized academic instruction within a small group setting, or specialized academic instruction in a setting outside of general ed for much of the school day. Students may also receive related services such as occupational therapy, counseling, physical therapy, or behavior support services, just to name a few. And those related services assist them to access their education. The students that we serve are very diverse and have a wide variety of needs. Some students need less intensive services, such as speech to correct articulation errors. And while some of our students have very great and intensive needs, they might need nursing service support in order to monitor medical functioning so that they can access their education. And we plan for and we serve each of our students as an individual and based on their unique needs. Sacramento City Unified is a large urban school district. Within our special education department, we serve between 6,300 and 6,600 students with special needs in any given year. We operate a full continuum of services and a full range of related support services to support our students. Services to support special education, students receiving special education are by nature more costly than services to educate students solely in general education. And in fact, depending on the student's needs, it's not uncommon for it to cost at least twice as much to educate the child. Federal funding and state funding is provided, as Mr. Druin said. It has never really kept up with the actual cost of providing the service, and each district must contribute a substantial and a growing amount of money each fiscal year to provide the IEP mandated services to students. And while it's appropriate for a district to contribute to the share of cost, the needed contributions have grown so much over time and can now very much significantly impact a district's budget health. So obviously increases in both federal and state funding would be greatly appreciated and assist us to serve our students. As has been stated before, in 2011, the SELPAs were given the responsibility to provide educationally related mental health services as one of the related services to assist our students. Initially, the shift from the contracts with county mental health providers was a challenge. However, over the past 4 years statewide, SELPAs have been able to develop comprehensive support systems and direct service models to provide mental health services to eligible students. In our district particularly, we have over 350 students currently receiving some sort of mental health service or counseling, guidance, behavioral support service in relation to the numbers of when we were they were served by county mental health. We never went over 100, so there is a difference. And although we can bill for LEA Medi-Cal reimbursement for the provision of many of the services, we don't have access to the full scope EPSDT Medi-Cal reimbursement that county mental health does. And we'd like to thank you for your support and action to provide legislation for us to access that EPSDT funding, and the State SELPA Association will continue to advocate for this legislatively going forward. One of the most significant tasks we've undertaken in the past 3 to 4 years is the implementation of the Common Core standards. Our district has provided many opportunities for professional learning for teachers, instructional support staff, and parents so that we could all have a solid foundation about what's different in this teaching and learning of these standards. One of the best outcomes of this implementation has been the very rich, inclusive learning opportunities for our teachers currently in general education and those teaching in more specialized settings. And our focus for designing access avenues for our students through universal design for learning is still in the growing stages, but we feel that this strategy will serve our students with special needs and will assist us to provide more inclusive settings over time for students. Our goal is and has been to ensure that each student that leaves our system is ready to engage in post-secondary setting or a career setting. It's imperative that our well-designed specialized academic instruction for eligible students supports the implementation of Common Core and the instructional shifts needed to ensure the students have options to them beyond high school. So to meet that goal, transition planning, starting at least at age 16, is very important and helps to provide a roadmap for students throughout their high school year. We have a workability program in our our SELPA, and that has helped greatly to assist students to develop employment skills while in high school that carry them after they leave our system. We also, particularly in our district, have a relationship between Sacramento City Unified School District, Sacramento City College, and Cal State University Sacramento to create a stronger and more seamless transition for students as they exit high school and pursue higher education. Of course, throughout this all, we are working to refine our relationships with our families and to work through issues as they arrive to prevent costly litigation. There will always be work to be done to improve this, but open dialogue with families that's transparent and proactive is our goal. As you've heard from us, it's very complex and costly, but we feel it's important that we diligently prepare our students for post-secondary and employment settings and to continue to expand their options as they become adults. Thank you.
Thank you. Thank you so very much. Mr. Hamilton, welcome.
Thank you for, thank you. Thanks for having us here today. I'm Bob Hamilton. I'm with California Association of Resource Specialists and Special Education Teachers. Talk about acronyms. CARS Plus. So what we did was we polled our members on the fact that we were coming here today, and we said, what should we say? So we got a limited number of replies in the few days that they had to do it, but they all had a common thread or two. And actually, I've heard the same common thread here today all afternoon. First of all, you always have unexpected consequences for good works. And since we began fully including students in general education, I started bringing them out of the bungalow at the edge of the field. Response to intervention, multi-tiered systems of support, all the things that are going on to bring students back into the general ed fold. Some of the unexpected consequences are that general ed teachers are now more and more responsible for those students and their instruction, which means that when you're dealing with a student who has specialized medical needs or mental health needs, you're pulling them out of a general ed class and they're losing instructional time to go meet with a counselor or to go to physical therapy. And in a lot of cases, the general ed teacher does not understand why this is going on. Mental health particularly is kind of, it's below the surface. So a lot of general ed teachers are saying, why are you taking this kid out of my class all the time? It's not, I have 180 kids a day. I can't deal with every one of them on this level. And that is an issue, which leads to the second issue, which is it's probably a credentialing issue, but general ed teachers and administrators they're not always aware of the intricacies, of mental health and physical health issues. And there's a lack of training and education on their part. Now, I want to, say first, there's no bad guys out here. Since I've been involved in CARS, I've been amazed at the people at the state level, at the county level. They're all good people doing the best they can with, trying to lead us through this thing. But general ed teachers aren't included in that training, at least in the responses we got and in my experience, not included in that training. It's kind of laid on the special ed teacher. Well, you're the specialist, so you take care of this part of it. Well, now we put the kid in the general ed class, and now we're no longer in control of that kind of stuff. So one of the things that is needed, before that, another issue that comes up is we had students who were getting counseling from mental health counselors, but it was done on an individual basis. Pull out of the classroom, go sit in the conference room, spend an hour. And there were two things that were problems with that. One is the general ed teachers were not ever included in that process. What we need is the counseling, the family, and we've heard this today over and over, the counseling, the family, the student, the staff at the school all to be involved together so that we're all on the same page, and we know that if I say this to you, you might just go berserk on me in class. And now I've got you and 29 other kids, and all I can do really is kick you out. The other thing that happened, and I have a feeling mental health, county mental health counselors should be paid more, because we were constantly, there was a constant rollover or turnover of mental health counselors. Somebody would come in and have a couple of meetings with a student, and then all of a sudden there'd be a new mental health counselor calling and saying, I need to set up a schedule. Well, we just set up a schedule. Well, now we need to set up another one because I'm new. Well, what happened to so-and-so? You know, well, he's in private practice now. So there was, mental health seemed to, county mental health, and at least in I was in a rural district. So in that district, it seemed as though the county offices were stepping stones. So also, there's a disconnect sometimes between schools and agencies. We had, I was invited to a ton of meetings for foster kids, and I finally went to one. It was at 11 o'clock in the morning, and they said, oh, you're the first teacher that's ever shown up at one of these meetings. And I said, it's because you always have the meetings during the school day. And they said, oh, we didn't think of that. So there was, you know, there's this silo idea is really true. When they came to our meetings, we were surprised, because our meetings were always at 4 or 5 o'clock in the afternoon, and they were supposed to be home. So, you know, our recommendations for best practices are a consistent and regular individual counseling with the student, with the parent, or with the family, with general ed teachers, administrators, counselors, and staff. Training for the school staff beyond what they're getting now. Adjustments and somehow, and I don't know how you do this. Service delivery systems are taking the kids away from special ed and putting them back into general ed. That can be an issue. Not that I'm against the idea, but it can be an issue. And adequate funding. Get us some money. No, we have. You know, there's not enough speech and language therapists. There's not enough school psychologists. There's not enough school nurses. There's not enough counselors. There's not enough librarians. I mean, you know, there's not enough special ed teachers. We get requests from districts weekly saying, do you know any special ed teachers that need a job because we need them? A district near us just has 19 special ed teachers, with air quotes, who are either interns or working without credentials at all on an emergency basis. It's a big issue in California, maybe in the whole country. I don't know about the rest of the country. I have enough problems keeping track of California. So thank you.